big changes that are coming to SNAP benefits that's going to affect everybody on food stamps. Let's get right into it. So, there are 5 big changes that I want to talk to you about under President Trump that is going to affect people on food stamps. And I'm going to explain in detail why food stamps cuts, cuts to food stamps benefits are definitely on the table. I'm going to talk about 5 Medicare changes that will affect everyone in 2025, including a weight loss drug that is now covered under Medicare. And then finally, the Social Security Administration is getting ready to send a lump sum payment of $4,320 in February this month to eligible beneficiaries under a recently passed law. I'm going to talk about who is eligible. So let's get started. If you're new here, hit the like button, hit the subscribe button, because all we do is bring you the latest news and updates about anything in and out of Congress that is going to affect your Social Security, Medicare, food stamps, and any personal finance issues that impact seniors. So before I do that, let's talk about Medicare Advantage enrollment for a second, because there's a critical window that has just opened, and this particular news headline is what scares me, and I want to talk about that. 1 million plus patients lose coverage as insurers, hospitals drop Medicare Advantage. Experts worry older patients could be exposed to catastrophic costs and interrupted access to care. So, why should you care? Well, Medicare Advantage enrollment is now, this is the opportunity, a small window for you to be able to switch to a different plan. And it runs from January 1st to March 31st. And here's the thing, there are 24,000 Medicare Advantage plans nationwide. And that is the reason why a lot of seniors get confused about which plan to pick. And so estimates shows that 90% of seniors right now on Medicare plans are in the wrong plan. That is costing you money, because on average, the couple spends $300,000 on Medicare during retirement. And it's also affecting your health, because if you need services and it's not covered, or you're in the wrong plan, then it's going to cost you money, but it's also going to cost you your health, because when you need it, you need it. And it may not be there because you're in the wrong plan. So let's talk about enrollment period. This is your opportunity to switch to a better Medicare Advantage plan. Now, how do you do that? Well, I have been doing content for seniors since 2011. We have websites that we've been running since then, and we have 100,000 followers on TikTok. And during this entire 14-year period, I have never recommended a Medicare plan, because it's never felt right until now. Today, we have a partner, Chapter Medicare, that is the right fit for you, that can help you find the Medicare Advantage plan that fits your need. And here are 3 reasons why we decided to go with Chapter. Reason number 1 is that they are the only Medicare advisor that is not only free, but have access to all 24,000 Medicare plans. They can see it all. Nobody can. Only Chapter Medicare can, which is one of the reasons why I wanted to work with them. And they can therefore personalize a plan for you based on where you live. Reason number 2, which is a very important one, they don't work for commissions. Their agents don't work for commissions. So you are not on the phone with them thinking they're going to sell you the highest plan because they're going to get commission for it. That's not how it works. They are there to give you one-on-one service to help you find the best Medicare Advantage plan that fits your need and your budget. And then third, probably most important, they can save you on average $1,100 per year. And that is why we decided to partner with them. I said, in my 14 years of doing this, I have never partnered with anybody. Chapter is the real deal. So call them at this number, 539-205-2147. Their agents ready to help you right now find the best Medicare plan, Medicare Advantage plan that fits your need and makes you avoid becoming one of the 90% of seniors that are on the wrong Medicare plan. So call Chapter. Now let's get to the 5 changes that are coming to food stamps. Now, I did this yesterday and I saw the comments, and I wanted to address some things, some concerns that some of you have, and also some questions that some of you have posed, and I want to answer that. There are 5 big changes that are coming to food stamps based on what President Trump has proposed, based on what the GOP in Congress have proposed, and based on what Elon Musk is now doing that I definitely think is going to lead to food stamp cuts. Let's get to it. So the first thing is that President Trump wants to bring back the harvest box. If you remember, back in his first time in office, he had this idea to turn food stamps into a harvest box, at least a significant part of it. And how that was going to work was that each month, rather than you going to the grocery store and using your food stamps card to buy groceries, the government is going to send you a food box. They're going to mail you a box, and that box is what is going to be your source of food if you're on food stamps. So you cannot go to the store and use your EBT card and buy what you want. The government is going to mail you what they call a harvest box. That idea got a lot of resistance. And now that the president has the Congress, both houses, the idea is back. So let's talk about it. What is the harvest box and why is it coming back? So here is an article that came recently, a few days ago. Trump past budgets have envisioned much more sweeping cuts to food stamps. This last one proposed a nearly 30% cut to the program, including new work requirements on top of those already in the program, and a plan to shift. Here's the big one: a plan to shift a big share of the program into a harvest box, a plan in which households would not get to choose the food they buy, but instead be sent a monthly box of shelf-stable foods that the government picks. Realistically, the writer was saying, and I suspect the box plan will be a struggle to gain traction, but I don't agree, because I think now that the Republicans have both houses of Congress and they have the presidency, this idea is coming back, and I think that it has a real chance of passing because they want to cut deep. They want to cut spending. Elon Musk wants to cut stuff. The president wants to. Congress wants to. And they have a huge tax cut. The Trump tax cut that was passed in 2017, he wants to extend it further permanently. That $5 trillion has to come from somewhere. And I'm going to walk you through the budget. Stay tuned. I'm going to walk you through the federal budget and show you why I think food stamp cuts are on the table, and perhaps Social Security and Medicare will be touched based on the $2 trillion that they're trying to save from the budget. Now, hear me out. I have the receipts. I'm going to walk you through the budget so that you make a decision for yourself. And the Agricultural Committee chair of the House is also on board in making significant cuts to food stamps. He wants to cut $30 billion over a decade, and part of it is to slow down how much increase you get in food stamps every year. So here is what's going on. $30 billion cuts in food stamps are coming up, which means that benefits are going to be cut. And then the harvest box is on the table, which could also make things significantly look different with the food stamps program. Now, this is what it looks like. Every month, the government will send you a box of food that they think you should be eating, and you have no choice, but that's what you have if this bill passes. And hopefully there will be some resistance. But the problem is that when it comes to food stamps program, who is really at the corner or who is really advocating for people on food stamps? There are certain things that have very powerful lobbyists in Congress. When you talk about the defense budget, there are big lobbyists that are ready to make sure that defense does not get cut. But when it comes to food stamps, who is really fighting? So when bills like this come up, when proposals like this come up to turn the program into a harvest box, who is really going to fight for you? I don't know, because there aren't people that are vocal about these things. People are not protesting. Food stamp beneficiaries are not standing in front of Congress protesting that they need their benefits. They stay quiet, and then the louder voices win. Change number 2. Let's talk about the cuts that are coming up. So Elon Musk wants to trim $2 trillion from the budget. And I'm here to show you, and I did it yesterday, and I've added some more information to make it even clearer. They want to trim $2 trillion from the budget. And I'm here to tell you that they cannot do it without cutting Social Security, Medicare, and food stamps. So hear me out. So here is the federal budget. $4.439 trillion is how much money the government brings in. And then the government spends $6.134 trillion as of 2023. So there's a $1.69 trillion deficit. Usually the government will borrow money to cover the deficit. That's why the national debt keeps growing. So now they want to cut $2 trillion from the budget to essentially balance the budget. But it is hard to do that without cutting programs that are essential to low income and seniors. And here's what it looks like. So where does the money come from? The federal government gets 50% of its money from individual income taxes. Another 37% comes from payroll taxes. And then they get 9% from corporations. So corporate taxes represent only 9% of the federal income base. And then the other 4% comes from things like tariffs and import duties, etc. So the president has been talking about tariffs. Right now, it's less than 4% of the income that the government brings in. So if tariffs is going to form a big part of the revenue, a lot is going to have to change to make that happen. So let's talk about how the government spends money. The biggest item is Social Security, followed by health, which includes Medicaid. Now, let me talk about Medicaid for a second, because when I talk about Medicaid and seniors are listening, a lot of seniors say, oh, I'm on Medicare. Medicare does not really affect me. But here's the thing. 50% of all nursing home payments for seniors are paid for by Medicaid. Medicare doesn't cover long-term care or nursing home care. It is Medicaid that covers it for low-income seniors who get to the point where they cannot afford to go to a nursing home or pay for it. And then Medicaid has to cover it. So you should care that they want to cut Medicaid because it's going to affect some seniors at some point. Then we have defense budget, income security, which includes food stamps and other low-income assistance program. And then you have net interest, veterans benefits, transportation, commerce and housing, and community development. All right, so here is the order and the details of things that are included in each section. If you look at number 5, which is income security, it includes SNAP benefits, housing assistance, unemployment, and so forth. So here's the detail, what it really looks like. In each category, I tell you how much the government is spending and what it pays for. So Social Security is the biggest, $1.345 trillion. Health, which includes Medicaid, Children Health Insurance Program, etc., $8.89 billion. And then you talk about Medicare, prescription drugs, medical services, $848 billion. Next, national defense, $820 billion. Income security, which is where I want you to pay great attention to. Unemployment benefit, SNAP benefit, supplemental security income, SSI, which is disability for low-income people who haven't qualified or haven't paid enough credit to get Social Security disability insurance. So if you're disabled and you haven't paid enough into Social Security, you get SSI, which comes from a different bucket. Then you have temporary assistance for needy families. You have housing assistance, refundable tax credit, etc., etc. And then you have interest on the debt, the national debt, the 300 and something, whatever, trillion dollars or whatever it is. That is the interest on the debt. And I think it's 32 trillion. Well, we're paying $658 billion a year as interest payment. And then you have veterans benefits, $302 billion. And then you have transportation, highways, public transit, etc., Coast Guard programs. And then you have commerce and housing credit. And then you have community and regional development, disaster relief and insurance for recovering communities, all the things that FEMA does and other disaster assistance program, all that comes into $87 billion. So that sets the stage for how much the money is spent on. Now let's get to the $2 trillion and why I think food stamps, Social Security, Medicare, Medicaid are all on the chopping block. So here is what all the big items total. So Elon Musk wants to take $2 trillion out of the budget. He wants to save $2 trillion. Well, Social Security, health, which includes Medicaid, Medicare, income security, and veterans benefits, if you add all that up, it's $4.168 trillion. That is about the amount that the government brings in revenue. So think about that for a second. That is the amount of money the government brings in, and it's all spent on these 5 programs. Next, I don't think Congress is going to touch the interest income because it is based on the faith and credit of the United States government. That is how the US government is able to borrow so cheaply versus other countries, because the US government's credit is really powerful because the US government always pays its debt. And so they can borrow cheaply because the rest of the world trusts that the US government will always pay its debt. So Congress is not going to touch interest because they want to keep borrowing to finance their pet projects. They're not going to touch defense. There's a huge lobby in Congress that is going to prevent them from doing anything regarding defense spending. So this is not going anywhere. So let's do some math here. If the 5 big things on the budget is 4.16 trillion, and the things that they're not going to touch is 1.47 trillion, where is Elon Musk going to get the $2 trillion from? You tell me, where is it going to come from? Because we are already, if you add the 4.16 trillion that forms the programs that I showed you earlier, and then you have the 1.47 trillion on the things that they don't want to touch, you come to 5.638 trillion. So what is left is $496 billion. That forms the other things that I talked to you about: transportation, highways, public transit, Federal Aviation Administration, Coast Guards. So that's where some of the money goes to. And then you have housing credit, postal services, interest payment, deposit insurance, and then you have disaster relief and insurance for recovering communities, and other things that form the 496 billion that is left. So if Elon wants to take $2 trillion out of the budget, I am telling you that the only place he's going to find the money, if they're not going to cut defense and they're not going to cut the interest because they don't want to jeopardize their government credit so that they can continue to borrow to finance their pet projects, then it's going to come from Medicaid, it's going to come from food stamps, it's going to come from SSI, it's going to come from SSDI, it's going to come from veterans benefits. Now, when I talk about SSDI and SSI disability, some of you will probably say, oh, President Trump says he's not going to touch Social Security, he's not going to touch Medicare. Well, that is his promise. But if they say they're going to cut $2 trillion, and Elon Musk now has access to the government payment systems, he has access to the Social Security payment system, he has access to where all the government money goes, and they want to cut $2 trillion, you tell me, either the $2 trillion is not true, or Social Security, Medicare, Medicaid, SNAP, SSI, SSDI, and Veterans Benefit are all on the table, because that is where the bulk of the money is. I have already showed you the math, and the math right now is not mathing if you want to take $2 trillion out of the budget. Now, let me talk about the president's promise for a second. Yes, he may say that he's not going to touch Social Security. He's not going to extend the Social Security full retirement age by a day. But there are things that can be done that can affect Social Security. And part of it is that there are 5 different proposals that are on the table that can affect Social Security. It may say that I'm not going to increase the retirement age, but they're going to make it harder for you to get Social Security increases. And so that is technically not touching Social Security. But if they slow down your cost of living adjustment every year, that will save 30% of the shortfall that Social Security experiences. So there are things that they can do that technically fall, yes, I'm not going to touch it, but it's still touching it. But my point is that I'm just speculating. And what I think is not important. What you think is important. So let's talk about, where do you think the money is going to come from? If they want to cut $2 trillion, which is 32% of total spending, and I have shown you where the money is all being spent, where is it going to come from? You tell me. If they're not going to touch defense and interest payment, then I think these are the programs they're going to focus on. And especially with disability, there are things they can do to kick people off disability, because every year, including veterans benefits, actually, every year there's a review of disability. So if you're on disability benefits, there is something called the annual review, and they send you a package to for you to fill out and determine whether you are indeed disabled. Remember how the government, President Trump, sent all the federal workers a buyout, and a buyout thing to really trim down the federal workforce? Well, they can send everybody on disability benefits a form to fill out so that they can evaluate or reevaluate whether you're disabled. It is part of the annual process anyway, and they can trigger that for everybody and scrutinize it further and decide that, oh, we don't think you're disabled anymore. We think you can work. All those things can happen if they are determined to trim $2 trillion from the budget. So now let's talk about mandatory spending and discretionary spending for a second. The things that I told you about, Social Security, Medicare, Medicaid, income security programs, are mandatory spending. They form 62% of the total spending. It means that Congress has to pay it. They cannot, they have to pay it every year. They don't have to, they can't negotiate it. But what they can do is they can pass legislation to reduce the amount of mandatory spending in the budget. They can definitely do that. Even though they are required to pay it, they can reduce how much they have to pay. And then when Congress is doing all the noise about budget, and you're hearing all the things about budget shutdown and the government is shutting down, that is all a fight over discretionary spending. That is what the Congress has control over. That is 28% of spending. And then interest is 10%, which I told you they're not going to touch. So mandatory spending is where the money is. Discretionary spending is defense, which I know they're not going to touch, and veterans benefits, education, transportation, all these things that they fight over is only 28% of the budget. So I want to hear from you. You tell me. My proposition to you right now is that I think if they're going to cut $2 trillion, it's going to come from Social Security, Medicare, health, Medicaid, income security, and it's going to reduce benefits for people. It's going to have stricter eligibility requirements. It's going to have limited services, and then it's going to be program cuts. That is just the math, and you do your own math and let me know in the comments what you think is going to happen. Now, the third thing is that they want to limit junk food in food stamps. This is taking steam. This is something that is really, really taking off. 23% or 2.5 billion of all SNAP purchases are spent on junk food. And the governor of Arkansas, who was the former press secretary for President Trump, is proposing that they pass a law to limit junk food in food stamps. I think this has traction and is likely to pass. The fourth thing that you might expect is stricter work requirements. That is one way to slow down how many people get food stamps. That is definitely something that is really possible to pass, and I'll be surprised if this is not one of the first things that they do. Stricter work requirements. And then finally, waivers. If you're in a state that got waivers to exempt you from certain food stamps requirements, I think they're going to put these back immediately because it's a low-hanging fruit. They can shut all the waivers down. Some of them are from the COVID era, and they can stop it all and bring back strict requirements for food stamps. So let me know in the comments what you think about potential changes to food stamps. Are they going to impact you? What is going to be the effect on you, especially on the harvest box idea, where the government is going to send you a food package every month of shelf-stable stuff that you have to eat instead of your SNAP benefits? Let me know in the comments. Now, let's talk about Medicare for a second. There are 5 changes that are coming that I think you need to be aware of. The first one is $2,000 out-of-pocket cap. You may not know this, but now, once you reach that cap, Medicare pays for everything else. And about 1.7 million Medicare beneficiaries currently spend over $2,000 annually on medication. So this is a huge, huge relief that once you spend $2,000 on covered medications, you're done. Change number 2, Medicare premium. This is where a lot of seniors get frustrated. and a lot of seniors get upset because your Social Security cost of living adjustment was only 2.5%, but Medicare Part B premium went up 6%. So already there's a misalignment. The money you're getting in is only increasing by 2.5%, but then, which is about $50 on average for each senior, and then your Medicare Part B premium is going up. So let me know how this is impacting you. Are you able to afford your Medicare Part B premium? Let me know in the comments below. Here is exciting news about Medicare. Mid-year notices. Starting summer 2025, this year, Medicare Advantage plans must notify members about unused benefit they've paid for. This notice details remaining coverage for services like dental, eye exam, hearing aids, etc. This is to make sure that if you're paying for a Medicare Advantage plan, you're getting all the benefits. They're going to send you a notice, tell you what you haven't used so that you will use it before you lose it. Number 4, which is another exciting good news, mental health expansion. Medicare now accepts more types of mental health providers, including marriage counselors and addiction specialists. The program is actively recruiting more mental health professionals, and telehealth for mental health has become a permanent benefit. This is really exciting. So you can get mental health counseling via your computer, via your phone, via your tablet, and do it confidentially. So that is the 4th change. And then the 5th one, which is very exciting, is that Medicare now covers certain weight loss drugs, which, when prescribed for health conditions like heart disease. Wegovy is specifically approved for cardiovascular disease patients who are overweight, covered. Basically, the FDA is looking at other forms of weight loss drugs that could be covered, and Medicare is going to be negotiating for some of these drugs. And here it is. So this year, they're going to negotiate 10 more drugs to lower prices starting in 2026. So if you need help with your Medicare Advantage, as I mentioned, call Chapter, our partner. They can help you find the best Medicare Advantage plan. The window is closing. It's only a short window, so make sure you call them or click on the description below. There's a form you can fill out. It's very quick and easy. And as I said, they have 24,000 plans in their database. They are the only ones that have access to all the Medicare Advantage plans. They can find you the plan that fits your need and save you $1,100 on average every year. So now let's talk about the final item on my list, which is the newly signed Social Security Fairness Act. This bill is going to give some Social Security recipients $360 a month on average increase. Some are going to get up to $1,190. And there is a lump sum payment coming, $4,300 on average, up to $14,280. What is this all about? Well, if you like what you're hearing, hit the like button, hit the subscribe button. Let's talk about it. So stay till the end, because I'm going to share with you people that were impacted by WEP and GPO that are going to benefit from this bill and what they have to say. So first, President Biden signed this into law, and 3 million beneficiaries will see their Social Security checks jump from 1,776, which is the average benefit monthly, to 3,166. It's been a 40-year battle. It's going to cost $190 billion, and government workers in certain states are about to get a huge boost in their benefits. The House voted on it overwhelmingly, and the Senate voted on it overwhelmingly. And the president signed it, former President Biden signed it in January 5th, and now the Social Security Administration is about to implement it. So who benefits? Well, it eliminates WEP and GPO provisions that reduce public servant benefits for 40 years. Major reforms impacting 3 million beneficiaries across the country. And starting in January, they're going to start seeing the money hit their paycheck or their Social Security check. Now, this all started with President Reagan. 1983, he passed a law that restricted public sector workers from getting Social Security and getting government pensions, even if they pay enough money into both programs to get both benefits. It also impacted their spouses and their survivors. So first responders and teachers who paid into the system did not get their money. State and local workers did not get their money. Survivors also were reduced 2/3 of the benefits that they could get. And they've been fighting this for 40 years. So finally, Congress relented, passed the bill, and now here is what you can expect. If you were impacted by WEP, you're going to get a $360 monthly increase in your Social Security benefits. If your spouse and you were impacted, you're going to get a $700 monthly increase in your Social Security benefits. If you're a survivor and you were impacted, you're going to get $1,190 monthly increase in your Social Security benefit. That's huge. I mean, $1,100, $700, and $360, all that is big increase compared to the 2.5% COLA increase that everybody got, which was about $40 on average. So you can see this is going to be life-changing, and there's going to be a retroactive lump sum payment that is go all the way to January 2024. So here's what it looks like. If you're impacted by WEP, your lump sum payment is going to be about $4,320. If you're on spousal benefits and you were impacted and you're getting $700 monthly increase, your lump sum payment from January 2024 to December 2024 is going to be $8,400. If you're a survivor and you were denied 2/3 of your benefits and now you're going to get $1,190 increase, the lump sum payment you're going to get is going to be $14,280. This is going to be a game changer for a lot of people. So what's going to happen? When is this going to be implemented? Well, the Social Security Administration is changing their systems and recalculating benefits to make this happen. They're testing their systems to make sure that everything runs smoothly, and they have updated in a news release that starting in February, they're going to start implementing. So when it comes to the lump sum payment, you should expect it in February or March, and then the monthly increase will follow after that. So here's the thing. A lot of you say that this is not fair, that the Social Security Fairness Act is not fair because it's only affecting 3 million people and the rest of you on Social Security are struggling, which is true because Social Security over the last 5 years has not kept up with inflation. And so the money you're getting in Social Security benefits has not kept up with the cost of living increases, and a lot of prices have gone up and stayed up. So let's talk about what these people who've been impacted by this, what they think, and then let's talk about whether it's fair or not. So here's somebody that says, some of us worked as firefighters where they paid into Social Security, they paid into the government pension, and when it's time for them to retire, they only got 60% of their Social Security benefits. So this is a real person, and this is the comment they posted online. Another person said, the government took $600 a month from them since 2009 from GPO. So they are real people that have been impacted by this and have been fighting for this for a very long time. Here's another person whose spouse has been impacted, $800 in benefits that was taken, and another person that paid into the system since 1982 and didn't get everything they deserve, and so forth and so on. But let's talk about fairness, because the rest of the beneficiaries on Social Security also have a valid argument that if Congress is going to pass a law to benefit a certain group of Social Security beneficiaries, they might as well pass it to benefit everybody else. So there's been a lot of Social Security increase bills that have been presented to Congress that never gained traction. And the question is, why have those not been implemented? So to get 2.5% cost of living adjustment, which for some people is $40 a month increase, it doesn't even cover your Medicare Advantage premium increase. And then some people are going to get $360, $700, $1,100, and lump sum payment up to $14,000. I think I can understand why a lot of people are upset. A lot of people think it's not fair, that this should have been done to cover everybody so that everybody gets an increase. And I don't disagree. I think it's a fair argument that should be made, and that Congress should try and pass a general across the board Social Security increase that at least helps seniors catch up to inflation. Because over the last couple of years, if you do the math, the increase in Social Security Medicare premium and the increase in Social Security benefit, and then compared to what inflation has been over the last 5 years, there's a big gap there that continues to chip away at the purchasing power of seniors on Social Security and Medicare. So I want to hear your thoughts. Let me know what you think in the comments. And I'm going to do another live tomorrow detailing some senior assistance programs and senior discounts that I've researched, and I'm looking forward to sharing with you. So hang in there with me tomorrow. And thank you for joining me today on another live. I'm doing this every day. So hope to see you tomorrow. Let me know what you think in the comments, and have a good night.